I'm Dr. Jeff Peck. In recent years, there's been a pretty dramatic move in both human and veterinary surgery toward minimally invasive procedures. One form of minimally invasive surgery is arthroscopy, which can be done primarily on joints, but also for some forms of spinal surgery. And this afternoon, we're going to be going ahead and seeing an elbow arthroscopy, heading into the OR in just a couple of minutes, and we'll see you in there. This is a yellow Labrador that has a problem in the elbow. So what we're going to do today is basically clean out this elbow joint, remove any fragments that are present. There may even be a fragment that's not quite loose, and we're just going to jar it loose and remove that fragment as well. For any arthroscopic procedure, there'll basically be three parts or three small holes. The first one will be a hole that allows drainage of fluid or fluid to be instilled into the joint. Then we have what's called the scope cannula, which is this instrument. And this will be ultimately the tube through which we will pass the arthroscope, which is the camera. And then there'll be a third hole that we'll put in, which is called the instrument portal. And through that hole, we'll place our grasping instruments. And then I'll go in with various instruments, whatever I need to remove the problem tissue. This is all very abnormal tissue, which should be nice and smooth. If you look at this bone right here, see how it's nice and white and smooth? This bone should look like that as well. So I've got a big piece of it right there. And then sometimes it's attached with a bunch of scar tissue, and we do what's called a gator roll to break it free without just pulling it straight out. It looks a lot bigger on screen than it is in real life. We've got the other big piece right here. And we can pull that out. I'm happy that there's nothing in there. And we tend to keep most of the patients overnight, but they can potentially go home the same day. I'm Dr. Peck.